How to fix long-term care in U.S. Panel releases some ideas. Vertical line PBS NewsHour. Player position, absolute. Number sign head number sign correspondent callout width, 120 px. Height, 103 px. Float, left, margin right, 0. Number sign head number sign correspondent callout divided margin bottom, 8 px. Margin top, 15 px. Number sign head number sign correspondent callout divided span padding, 2 px. Border, 1 px. Solid number 1 D3442. Font, bold 13 px. Arial, Helvetica, sans serif. Color, number 1 D3442. Number sign head number sign correspondent callout H4. Font, 12 px. Georgia, Times New Roman, Times, serif. Color, number sign D1819. Number sign head number sign correspondent callout H4. 8 font, 12 px. Georgia, Times New Roman, Times, serif. Color, number sign D1819. Number sign head number sign correspondent callout H4 hover font, 12 px. Georgia, Times New Roman, Times, serif. Color, number sign D1819. Number sign head number sign correspondent / asterisk headshots are 155x 103 px asterisk / width, 155 px. Height, 103 px. Float, left, margin, 0. Background image : URL http://www.pbs.org/newshour/images/ primary to /whenIfill.jpg. The Morning Line. Your daily dispatch from the NewsHour politics team. Previous entry. Block Maine. Health, September 13, 2013 at 7:12 p.m. at How to fix long-term care in U.S. Panel releases some ideas. By Kaiser Health News and Susan Jeff. Registered nurse Susan Eager discusses medication with patient Helen Ricci, 96, during a house call in Denver. Photo by John Moore / Getty Images. A commission created by Congress to address the country's surging need for long-term health care released recommendations Friday but did not reach a consensus on how to pay for these often expensive services. The proposals were part of a report that received bipartisan support from 9 of the 15 commissioners, 5 Republicans and 4 Democrats. It also was rejected by a bipartisan minority, 5 Democrats and a Republican. The group's full report is expected to be released next week. The 3-page summary of recommendations tackles a wide-ranging list of concerns but offers few specific remedies. Among its many proposals, the panel calls for supporting criminal background checks for long-term care workers, ensuring that family caregivers are included in care planning, using more technology to share information, revising scope of practice rules to allow nurses and others to provide medical services, and improving working conditions and opportunities for direct care workers. The panel did not agree on a recommendation for a program to help families pay for long-term care services. However, it makes some suggestions for improvements to current options, including allowing disabled workers access to Medicaid, the federal state health insurance program for low-income families, to pay for services they need in order to keep working. It also recommends eliminating Medicare's requirement that beneficiaries spend 3 days in the hospital as admitted patients in order to receive nursing home coverage. "I'm hoping there are members of Congress who will look at this and say this makes sense," said Grace Marie Turner, president of the Galen Institute, an Alexandria, VA, think tank, who was appointed to the commission by House Speaker John Boehner of Ohio. Almost all of the recommendations have equal support from Democratic and Republican appointees. But Judith Ferrer, health policy scholar at Georgetown University Public Policy Institute appointed by Senate Majority Leader Harry Reid of Nevada, said the commission did not fulfill a key assignment. She and other 4 Democratic-appointed members who voted against the recommendations later offered their own plan, including establishing the National Social Insurance Program that would help cover long-term care expenses, setting better pay scales and training for direct care workers, and changing the Medicare system to help beneficiaries get more coverage for services and improvements in Medicaid benefits. "The fundamental issue in getting people the long-term services and supports they need is an issue of financing," she said. And this commission did not address that issue. Mark Warshawski, the commission's vice chairman appointed by Senate Minority Leader Mitch McConnell, RKY,